Homeland Security will come to order. The committee is meeting today to receive testimony on the federal response to the coronavirus. Without objection, the chair is authorized to declare the committee in recess at any point. Good afternoon. Today, the committee is meeting to examine the federal government response to the novel coronavirus pandemic. As a nurse, I want to open by encouraging everyone to visit coronavirus.gov for the most up-to-date information from the Centers for Disease Control and Prevention. And take care to practice habits that'll keep us all safe. Wash your hands often with soap and water or use hand sanitizer. Don't touch your face, cover your coughs and sneezes, and avoid close contact with others if you or they are sick. We know that the spread of coronavirus has likely not yet reached its peak, and it's affecting all of our communities. I don't think there's a person in this room who isn't worried about an elderly or immunocompromised relative's health, a friend's job, or a child's school closure. Just yesterday, the first 2 cases were diagnosed in the counties that I represent in Illinois. Our jobs as members of Congress is to keep Americans safe by working with the executive branch to lead a strong federal government response, including the House-led $8.3 billion supplemental funding package that passed last week. A strong response must include each of these 3 elements. First, we must continue to support our local and state public health departments, our healthcare system, our emergency responders who are at the front lines of this outbreak. This starts with having reliable data to make decisions, like how to prepare for a surge to our health system and how much personal protective equipment is needed for health workers. It also means developing and disseminating clear, accurate risk communication to the public. America's scientific and public health expertise is unmatched throughout the world, and it must be driving our decisions. Second, we must protect people from healthcare costs associated with coronavirus. Testing and treatment must be widely available at no cost to patients, and price gouging of medical essentials and other supplies must be stopped. If we do not take these crucial steps, the epidemic will worsen because families will avoid seeking care for fear that they can't afford it, and our communities will be less safe. Third, we must soften the economic impact of this crisis on American families and small businesses. This means paid sick leave for every worker, unemployment insurance, and food assistance if needed. Given the committee's jurisdiction, today we will also examine the Department of Homeland Security's role in the coronavirus response effort. The department plays a key role in protecting workers on the front lines of this outbreak, processing travelers entering the U.S., and referring them for screening by healthcare workers as necessary. We will have questions today about the efficacy of this screening and how it's being performed at our air, land, and seaports. We also want to learn more about the department's ability to protect its own workers, whether it has adequate personal protective equipment for frontline personnel such as Customs and Border Protection officers, Border Patrol agents, and Transportation Security officers. Finally, we want to hear about what plans the department has to ensure continuity of operations at certain essential facilities in case of outbreaks there, such as ports of entry, TSA checkpoints, and immigration detention facilities. Today, we're joined by Mr. Ken Cuccinelli, who's currently serving as the senior official performing the duties of Deputy Secretary of Homeland Security to respond to these important questions. Mr. Cuccinelli is also the department's representative on the White House Coronavirus Task Force. I hope to hear from him about the work of the task force this afternoon. He's joined by Dr. Stephen Redd, a medical doctor and epidemiologist with decades of experience with the Centers for Disease Control and Prevention. It's my understanding that Dr. Redd was due to retire this month, but he's agreed to stay on to assist with the coronavirus response. We thank you, sir, for your dedication and service to our country, and thank both of our witnesses for being here with us today. I look forward to a productive dialogue with my colleagues and our witnesses today.